Good. Mr. Smith, my name is Cheryl. I'm going to be your nurse today. I'm going to close the door for privacy. I'm going to clean my hands. We're going to change your catheter today, your catheter dressing actually. I've checked the orders and I've gathered the supplies, so we should be ready to get started. I'm going to pull your covers back and I'm going to check your identity. Can you tell me your name and your date of birth? Okay, good. All right, great. All right, in the meantime, I'm going to give you your mask. And I'm going to get my mask on. My glasses. Okay, if I can breathe. All right, let me get some gloves. Before I get started, I need to ask if you have any allergies to skin protectant or tape. No allergies to those? Okay, great. So if the patient was running an IV at this point, I would stop it, clamp it, disconnect the tubing. But he does not, so we're good there. So I'm going to go to the patient, and I'm going to assess this. I'm going to touch around it and palpate it. Do you have any pain or tenderness? No? Okay. And visually, I don't see any drainage or anything from this area. So at this point, I'm going to secure the patient's catheter. I'm going to start from the outside edges. And I'm going to remove the dressing. I'm going to bring it to the center. All while trying not to dislodge it. Get all the edges up. I'm going to switch hands here. Get this side. Okay. I'm going to hold that still while I remove the dressing. Have it. I'm going to fold it up in my glove. I'm going to remove the microbial disc. Have it also. While I'm here, before I chunk these gloves, I'm going to look at the site around the sutures, make sure there's no drainage, no redness, no signs of infection. Everything looks good. I'm going to take these gloves and I'm going to chunk them. Yeah, everything looks okay. I'm going to go here. I'm going to open up the sterile field. I'm going to open up the microbial disc, the new one, and toss it in there. I'm going to chunk that. I'm going to grab my sterile gloves and open these up. And on a normal bedside table, we wouldn't want to go off the edge, but I'm limited for space, so I'm going to do the best that I can. Okay. I'm really terrible at this, so y'all please bear with me. Okay, I'm going to get this one on. Okay, and I try not to really mess with the cuffs much just because I'm scared I'm going to get out of the sterile field. Same thing here. Stay over the sterile area. Okay, while I have my gloves up, I'm going to grab. So he doesn't have any drainage or redness. If he did, if he had any blood, dry blood, I would grab an antimicrobial wipe and clean in a circular motion. But he doesn't have any of that. So I'm going to grab my chlorhexidine and snap that. I'm going to do a back and forth motion for the cleaning for 30 seconds. I'm not going to do the whole 30, but you know I said 30 seconds. So I'm going to trash that. I'm going to let that dry. While that's drying, I'm going to grab my skin protectant. Actually, I'm not going to grab that yet. I'm going to put the microbial disc on first. On him. Now I'm going to do my skin protectant. I'm going to open this up. I'm going to wipe around the area. Okay, I'm going to let that dry. So while that's drying, I'm going to grab my dressing. Before we add the dressing though, I want to note that the hub is flush against the skin, so we don't need to measure that. It's not dislodging or anything. I'm going to grab my sterile dressing. I'm going to come here. I'm going to go down. We're going to attach that there. Get that on good and secure. Make sure everything's okay. Make sure everything's still tight. I'm going to remove that. good. Got that situated. Okay, I'm going to toss that. So we have a new dressing on. So at this time, I'm going to grab a new cap. I'll remove the old cap, grab a new one. I'm going to clean it really, really good with an alcohol swab. I'm going to get a flush. I'm going to attach it. I'm going to push a little bit, make sure everything's patent. I'm going to come to the first lumen. I'm going to attach the new cap that's been sanitized. I'm going to unclamp it. I will attempt to flush a little bit, make sure I have no resistance. I don't feel any. So at this point, I'm going to aspirate and make sure I get a flash. I'm getting a flash. So I'm going to go ahead and push this flush of 10 mils over a minute, slowly. So if I push that for a minute and I was done, if the patient had a order for heparin, this is not garbage. If the patient had an order for heparin, I would clean again and then flush with heparin, but we don't have orders for that. So now that I'm done, I'm going to clean that again with an alcohol swab. I'm going to clamp my tubing. I'm going to come with a fresh antimicrobial cap, and I'm going to attach it here to this end. Okay, now that I have that one done, I'm going to come here. Same thing with this one. I'm going to get a new fresh cap, clean it really, really good. I'm going to attach my flush, make sure it's patent. I'm going to come here. I'm going to clean this port. I'm going to attach my new cap. I am going to flush a little, no resistance, aspirate and look for a flash, have that, push that one over a minute. Once that one is done flushing, I'm going to clean that again and apply an antimicrobial cap to this area as well. Ooh. My point, they don't really stick on there. Okay, same thing with a third one. I'm going to grab that. It's clamped, everything's good. I'm going to come here. I'm going to clean this really, really good with an alcohol swab. Grab my flush, make sure everything's good. Come to the third lumen. Clean the area, attach the new cap, flush a little, no resistance, aspirate, look for a flash, have a flash, push over a minute. Once that's pushed, we're going to clean that and we're going to add a antimicrobial cap to that one as well. Once we have that done and everything looks okay, I'm going to clean up my supplies. I'm going to take my mask off my patient. I'm going to clean everything up. I'm going to throw it in the garbage. I'm going to perform hand hygiene. I'm going to ask the patient if he's feeling okay. Are you doing okay? I'm going to cover this back up. I'm going to cover you back up with your blanket. Now, we didn't get a drape in our kits that the school provided, so if I had a drape like the guy in the video did, I would have placed the drapes under the lumens, but we didn't have one of those. And also, I was going to let my patient know why he has a central line. It's because your veins in your arm or any other peripheral sites are not good enough, and plus you're getting multiple antibiotics at a time, and so it's easier this way so they don't interact with each other and you get all the meds that you need. Also, you have to be careful when you're up and moving around so you don't dislodge that. Like any movement can pull it out. So that's why we ask you to be really careful when you're moving. But as far as that, he did good. I'm going to lower his head back down, and that is it. Oh. And also, I almost forgot, I'm going to put the date and the time that I did the dressing change, and I'm going to initial it. So now, after I did that, I'm going to wash my hands again. And that is it.